Hi, I'm Julie Beamer, and this presentation is about staffing shortages in healthcare. The COVID-19 pandemic that began in March of 2020 resulted in 1.5 million healthcare jobs lost in the first 2 months of the pandemic. And although many of those jobs have returned, employment in the healthcare field still remains below pre-pandemic levels. The nursing shortage is expected to reach 1.1 million by the end of 2022. And it's not just nurses, but all professionals from medics to lab workers to sonographers and beyond. Staffing shortages are the biggest patient safety concern in healthcare today. Patients have longer waits for care and are sometimes turned away completely, even in life-threatening situations. And clinicians are caring for more people because the patients have not stopped needing care. Staffing shortages mean that hospitals cannot accommodate surges. If the pediatric intensive care unit is at capacity, for example, due to a lack of staffing, not a lack of beds, and there's a surge in RSV cases requiring hospitalization, there's no space. Best practices for bed utilization must be employed. Determinations must be made about which patients can be moved where. For instance, a stable heart patient may be able to be moved to a step-down unit to make room for a sicker patient, though it may not follow predetermined protocols and standards of care from periods prior to staffing shortages. This also requires communication with regional hospitals and determinations of who can be transferred safely. The first of the three acute angles of the iron triangle is cost or cost containment. In order to provide care, there are technical requirements that are capital budget purchases. The next cost is human capital. Pay for employees is increasing and also must be fair and equitable. Then there's the added expense of hiring temporary employees to fill open positions. These temporary employees are paid at a premium. All of this is occurring while the reimbursements are decreasing. The second point on the iron triangle is quality. When understaffed, clinicians are caring for more patients. This leads to burnout and increased errors. In the time between February 2020 and February 2021, central line associated bloodstream infections and pressure wounds increased by 28%. These two are a measure of quality in healthcare organizations. The third point on the iron triangle is access. These staffing shortages affect access to healthcare because, simply stated, there aren't enough caregivers to provide care. This occurs even in life-threatening situations, and again, they may be turned away completely. The iron triangle is a zero-sum game. A gain in one, cost, access, or quality, will lead to losses in the other two. Gains in access may be very costly, except maybe in situations where efficiency is significantly improved. Costs increase because more staff is needed and more space is required, and quality may suffer because of the volume. Quality improvement initiatives may be costly as well, if the improvement is also requiring more time, thereby decreasing access. Significant cost reductions may decrease quality of care in this particular situation with staffing. That may mean a nurse has more patients assigned to them, possibly leading to less frequent vitals and wound checks for one patient, and if another has more needs, this denies the other patient the care they need. Dr. Don Berwick, a former director of the CMS, cited that almost 20% of healthcare costs in the U.S. is due to overtreatment, lack of care coordination, lack of completion of care processes, and fraud. This is in addition to operating costs. Quality. While this term may be difficult to define clearly, patient outcomes are the typical measure of quality. Some quality measures include JCAHO accreditation and staff-to-patient ratios. Process measures like average length of stay and adherence to established clinical practice guidelines. And finally, outcome measures seen such as morbidity and mortality, infections, complications, and readmissions. And access. The Patient Protection and Affordable Care Act has made it so many more Americans have insurance. However, more Americans with insurance has led to more Americans seeking health care. So more patients are requiring care from an already overburdened healthcare system that is understaffed. Staffing shortages affect both quality and access. Appropriate staffing is costly but necessary in providing high-quality care. And a robust recruitment program to bring in new talent must exist alongside a retention program aimed at employee engagement and growth and development to keep current talent. Thank you.